Actually, our next speaker has already been introduced by Miguel several times. Dr. Doug Martin is a professor at Auburn University School of Veterinary Medicine, and he's the cat man.
No, is that a good thing or a bad thing,
That's
Dr.
a good
Tip?
thing.
No. Okay, thanks everybody. What a great afternoon. Christine and our friends at Lysogene, Sam, what a great idea to bring us all together and talk about GM1 gangliosidosis research. It's a tremendous thing. I can tell you there have been lots and lots and lots of days in the lab when I wondered if anybody in the world out there cared about what we were doing. But over the last decade or so, it's been a fantastic thing to come and see all of you every year and know that what we're doing actually makes a difference. What we're going to talk about today are the gene therapy experiments in the cats. Actually, go ahead and, next slide. Miguel already talked about some of this data, so I won't spend a whole lot of time on it. But basically what you're looking at here is a survival curve for cats with GM1 gangliosidosis. Every time the line drops, like right here, that line drops, that means an animal has died. This line shows the death of untreated cats with GM1 gangliosidosis. They survive about 8 months, and then they can no longer stand, and that's the point at which we euthanize them. Animals treated with two different so-called serotypes of gene therapy or adeno-associated virus do much, much better, and their average survival is out over 6 times the untreated lifespan right now. Many, many of those animals, I'd say 80% of them, don't really show any clinical signs. Some of my really excellent veterinarians can find some clinical deficiencies in these guys, but if I brought them into a room right now, into this room, and let them run around on the floor, it probably would not be a good idea, but you would not be able to tell a difference between them and a normal cat. So those results by direct intracranial injection of gene therapy into the brain have been fantastic. That's our gold standard right now. Miguel mentioned that we've been working on this for 10 years together. Some of the cats are out over 6 years of age right now. Untreated cats live 8 months. These guys are out over 6 years of age. So this is the therapy that we are by far most comfortable with because we have the most experience with it. I think this is a clinical rating scale that we don't really need to go into, but basically what it shows is that the majority of the treated animals do almost as well as normal for a very, very long time. In any treatment group of 5 to 6 to 7 cats, there will be 1 or 2 that don't do as well, but the majority of them, 75% or so, do really, really well. Next couple of panels are movies that you've already seen, so we can skip those. These are MRI results from Dr. Edwards. Sits for many, many hours in our MRI facility at Auburn and does fantastic MRIs of cats that have been treated and untreated cats with GM1 gangliosidosis. What you're looking at here primarily is the white matter of the brain. This dark area that it extends up into the cerebral cortex. In a normal cat and in a normal person, it should be dark on this particular set of images. In an untreated GM1 cat, that white matter is primarily gone. There's a little bit there, but the majority of it is gone, and it represents the loss of myelin, the substance that surrounds neurons and allows them to effectively function the way they're supposed to. In cats that have been treated and now 5 years of age, you can see there's a dramatic preservation of white matter in the brain. This is not 2 or 3 months after treatment. This is 5 years after treatment, and their brains still look relatively normal. Keep this image in mind because we're going to talk about cats that have been treated by IV gene therapy at the end of the presentation, and I want you to be able to think about what these MRIs look like in the cats treated by direct brain injection compared to the MRIs that from the cats that were treated by IV injection. MR spectroscopy looks good. This is a lot of data that we don't need to go over, but basically we are looking, Dr. Tiff talked about what MR spectroscopy is about. We're looking at different metabolites in the brain and whether they're there in normal levels or high levels or low levels and how they've been corrected by gene therapy. What this shows is that a lot of those metabolites are abnormal in untreated cats and corrected to normal levels in treated cats. In collaboration with Dan Ori at Washington University, St. Louis, we looked at GM1 ganglioside levels in the cerebrospinal fluid of these treated cats. In normal cats, very low levels of GM1 ganglioside. In untreated cats, very high levels of GM1 ganglioside in the cerebrospinal fluid. In the treated cats now that are out 3 to 5 years after treatment, the levels of GM1 ganglioside are normal. Very good biomarker that Dr. Edwards and Dr. Ori and my lab developed together. So that's very exciting for us to have a nice biomarker that we can use to track disease progression and something that is so directly related to the disease cause itself, GM1 ganglioside. Next slide. We looked at the correlation of the MRS data with actual clinical signs, and you can see that just take GPC plus PCH. That's just one of the molecules that we're looking at in the brain. And it correlates fairly well with disease progression. Our clinical rating scale is here. 10 is normal, 0 is really bad disease, and you can see that the more GPC plus PCH you have, the worse the better the disease, or the worse the disease is. So in the treated cats, that gets much better, but comes down to normal. In untreated cats, the GPC plus PCH levels are high, indicating bad. So that's another good way that we can use to image or to follow the disease progression in living animals, which means hopefully we can apply that technology to humans in clinical trials as well. Okay, we looked at AST and LDH in the cerebrospinal fluid as well, another couple of biomarkers that we use to track disease progression. In normal cats, the AST levels in the cerebrospinal fluid are about here. In untreated GM1 cats, the levels are about 5 times above normal. And in all of the treated cats, regardless of at what time point we look after treatment, those levels have been brought back down to normal. So as I was saying yesterday in the GM2 presentation, all of the data that we gathered was sort of pointing us in the same direction. Same thing here. All of the data that we're collecting points us in the same direction, that this is a very, very effective way of treating GM1 gangliosidosis in the cats. Same story for LDH, and we don't need to talk about that, so we'll go on to the next slide. Miguel showed a similar slide to this one, which basically shows where beta-galactosidase activity is in the cat brain after treatment. So everywhere that you see blue staining, that's indicative of beta-galactosidase activity. This is a normal brain from a normal cat. You can see a lot of blue staining. That means there's a lot of beta-gal activity. In an untreated GM1 cat, there's just a little bit of activity there, ranges between 3 and 5% of normal. In the treated cats, we're going all the way from the front of the brain. This is this block A, which is right here all the way at the frontal pole of the brain. Go all the way to the end of the cerebellum, the caudal cerebellum, and you find beta-galactosidase activity everywhere throughout. Same basic thing when we look at the spinal cord. Find beta-galactosidase everywhere throughout the spinal cord. And this is after 2 injections into the thalamus, 2 injections into the deep cerebellar nuclei. The surgery in the cats takes about an hour and a half. This is our gold standard. This is what we are really excited to be working with Lysogene on to take into human clinical trials. Okay, next slide. This is for Dr. Cindy Tift. This is of all the work we've done, all the videos, all the data, I think this is Cindy's favorite slide of all, because it shows that a GM1 male, his name is Lane Stephen. No, just kidding. It's Spot. This is Spot. GM1 male bred to a GM1 female produced a litter of all GM1 kittens. The reason that's important is that it's never happened before in the 40-year history of the research colony. So not only are we showing an ability to correct a cat's walking or ambulation, we show that there are other important benefits as well, restoring reproductive function. Okay, next slide. Now, that's the gold standard. That's direct intracranial injection of gene therapy to treat GM1 gangliosidosis. That's being moved forward by Lysogene to get into human clinical trials very soon. You may ask, with those kinds of results, why are we doing anything else? Well, it took us about 10 years to get to this point where we are now. And if we just stand still and don't look at other types of treatment, then it'll be another 10 years before we get anything done after the first clinical trial is done. So we need to be constantly developing new alternative supplemental treatments as those that have already advanced to a certain position are getting moved into human clinical trials. And so we decided to try IV gene therapy based on some of the papers that Miguel talked about in his presentation. I told those of you who saw this yesterday that this is a completely staged picture. If this cat was actually being injected with a needle, it would not be sitting there looking at us so nicely. This is Zebra. He's one of our nicest cats in the colony, but none of them tolerate IV injections that well. They get a little tranquilizer, they get an IV injection, they wake up in 30 minutes and everything's great. So it's an easy thing for us to do. Next slide. This is the brain of cats that have lived out to 2 years after treatment by an IV injection, a single IV injection. And I wanted you to remember what that last MRI image looked like. This is normal, this is untreated, this is treated. And you can see that the white matter in the treated animals is almost, it's pretty much normal. Some radiologists could pick out some deficiencies in the MRI, but basically it's a normal MRI in both the thalamic region and in the deep cerebellar nuclei. Compare the deep cerebellar nuclei to normal, and it looks really, really good. So we're very happy with that. These cats, again, are 2 years old. Untreated lifespan is 8 months. Okay, next slide. Dr. Edwards looked at the white matter. She actually quantitated the amount of white matter in the brains of treated cats and untreated cats. You can see that the white matter in untreated cats, there's much less of it. So we've lost a lot of myelin, lost a lot of white matter. In the IV-treated animals, that white matter has been restored to normal levels in both the thalamus and the cerebellum, which are the two primary areas that we are looking at. Next slide. Did MR spectroscopy in the cerebellum, and without going again through all of these metabolites, we'll just pick out one, GPC plus PCH. It's at this level in normal animals. It's significantly elevated in untreated GM1 animals. And then this is a normal animal at 2 to 5 years of age, and a treated animal, IV-treated animal at 2 years of age, the level of GPC plus PCH has come down to a normal level, indicating that the level of myelin has been preserved compared to untreated animals. Next slide. Betagalactosidase activity in the cerebrospinal fluid. We wondered about that. In our previous studies, we showed a pretty dramatic elevation of beta-galactosidase activity in the CSF after direct intracranial injection. We looked at these cats that had been injected by IV, and we saw about a tenfold increase, an increase to tenfold above normal beta-gal activity in the cerebrospinal fluid of these cats, indicating that beta-gal is actually getting to the central nervous system. Biomarkers that I mentioned already yesterday and then earlier in this talk, AST and LDH. This is a normal level of AST in the cerebrospinal fluid. In untreated GM1 cats, this is about a 5-fold increase in AST. In the treated animals, it's back down to normal. Everything that we're seeing is telling us the same, giving us the same answer. Next slide. Storage in urine. So we focus primarily on the central nervous system right now, but there are peripheral disease manifestations that could show up if the animals are able to survive long term. So we looked at storage in urine to see if we're affecting the peripheral organs as well by this IV treatment. Normal level of glycosaminoglycans, which are the storage material that we're talking about in urine. This is normal. In the untreated animals, there's an elevation that's statistically significant. And then in the treated animals, the level of storage in urine is returned back to normal. We'll not talk about the urinary bladder volume. Let's go to the next slide. Okay, so this is where the rubber really meets the road. All of this stuff looks good. The MRI looks good. The beta-gal activity in the CSF looks good. The biomarkers look good. What do the cats look like? This is our clinical rating score. 10 is normal. 2 is the point at which the cats cannot stand any longer, and so we euthanize them at that point. The black diamonds are the untreated animals, and they fall off pretty quickly. The blue circles are the treated animals. So they have a little bit of a decline initially, and then they plateau long term. Their clinical rating score is an 8.5, and what that means to you and to us is that they have a very slight tremor that you won't be able to see on the video that I'm going to show you, and they have very slight hind limb weakness. And other than that, they are completely normal cats. I don't think you'll be able to pick up the slight hind limb weakness on the video either, but you might be able to. Okay, let me set up this video before we play it. One of the things, sometimes when we take the cats out to video them, they've been sleeping or they've just eaten or something, and they don't really want to walk around very much. So one of the things that they love is like one of these laser pointers. And so if I'm ever really depressed, I go into the colony and I get out a laser pointer and I start, putting the cats out and let them chase the laser pointer. Well, I don't know if you'll be able to see it, but we're going to put a laser pointer about right there and motivate this cat to go after the laser pointer. And then just to show you that the cat's not completely crazy, we'll do just a normal walking sequence after that. The cat is going to go berserk. Here we go. I'm going to get that thing. I know I can get it. And so here's the normal sequence of just this cat walking normally to show you that, the cat really is basically a normal cat, even though it hates the laser pointer. And that hatred of the laser pointer is not induced by gene therapy. Any cat hates it. So this lady, this is Christine, not named after Christine, but we could say that it is. 2 years after treatment compared to the untreated lifespan of 8 months. All right, next slide. This little fella is Porter Heatherly. I know a lot of you have followed Porter on Facebook, and every time Sarah comes to a meeting, I make her stand up, so I put this in there to remind me that. This is Sarah Heatherly, and Porter's Aunt Michelle is right next to Sarah. But one of the great things about this meeting is that we can all meet each other in person and talk and share experiences. And I know Sarah's not been to a meeting before, so please, if you have a chance to say hello to Sarah before she and Michelle get out of here, that would be fantastic. And also, really, guys, this is why we do what we do. It's a lot of hard work, but this is why we do what we do. Next slide is the number of people that have worked on this at Auburn University, not on a daily basis, but a lot of these do work on this on a daily basis. Heather Edwards is here, has done an absolutely outstanding job in putting a lot of this MRI stuff together, a lot of the clinical assessments. We've had many graduate students, veterinary students, undergraduate students, a lot of funding. We're happy to be funded by Lysogene for some of this work. And then the next slide shows my fantastic collaborators in the Tay-Sachs Gene Therapy Consortium, and then a recent collaboration started with Dan Ori, and then Dr. Tift has always, we've been working together in many capacities for many years, and it's always a pleasure to work with Cindy. So that's all I have to say, and be happy to answer any questions that we have time for.
Actually, the fact of the matter is, Sue told me we don't have time for questions. So,
I get off.
Because we're at the end.
I get off
However, in 15 minutes, when Stacy is finished her presentation, we are all going to a reception right outside.